Most people think SI joint pain needs rest, stretches, or even surgery to get better, but that belief is actually keeping them stuck. What they really need is a precise chiropractic adjustment and not just of any kind. In this video, I'm walking you through exactly how we treat SI joint pain using 3 different chiropractic adjustment techniques most people have never experienced. They're gentle, targeted, and backed by thousands of patient results. If you've tried everything and still feel that deep ache in your lower back and hips, this might be just the missing piece. Welcome to World Class Chiropractic's official channel. I'm Dr. Peter Turner, one of the dedicated chiropractors at World Class Chiropractic here in Ellicott City, Maryland. Our mission is to help you achieve your health goals, whether it's reducing pain, improving mobility, or enhancing your overall well-being. Now, before I dive in, be sure to subscribe to our channel if you want expert tips, effective strategies, and practical guidance to help you live a pain-free, healthy, and fulfilling life. Let's start with the basics. What is the sacroiliac joint? The SI joint connects your spine to your pelvis. You actually have 2 of them, one on each side of your lower back, where that sacrum joins the iliac bones of the pelvis. These joints are built for stability, not movement, but they do allow just enough motion to act as shock absorbers between your torso and your legs. So why is the SI joint dysfunction so painful and debilitating? It's because whenever that joint becomes irritated, whether from too much movement or too little, it creates inflammation and instability. That pain often runs deep and sharp, and because the joint is located at the base of your spine, it affects everything: bending, sitting, standing, walking, you name it. And here's where it gets tricky and why so many people misdiagnose it. The SI joint pain doesn't always feel like back pain. Patients will often point to the upper part of their glutes, right where that SI joint sits, and say, "This is right where it hurts," thinking it's their hip, but really it's their SI joint. SI joint dysfunction can also refer pain to the back of the thigh, typically stopping just above the knee. In some cases, it can even refer pain into the groin, which adds even more confusion when really trying to identify the source of the pain. So if you're dealing with any pain in that upper gluteal region, especially if it's affecting how you move throughout your day, there's a very good chance your SI joint is the real cause. Before I demonstrate our 3 chiropractic techniques for SI joint pain relief, let me first walk you through our typical examination. Now, when a patient comes in complaining of that deep ache in the upper gluteal region, or even pain referring into the back or the back down into the thigh or groin, what we do is we start with a thorough evaluation. This includes a detailed history of any symptoms they're experiencing, postural analysis, as well as a range of motion testing to see just how that joint is moving or how it's not moving. We'll also perform specific orthopedic and neurological tests to rule out any other causes like disc issues or true hip joint pathologies. And in some cases, we may take x-rays to get a better look of the alignment of the pelvis and the lumbar spine, especially if there's a history of trauma or long-term dysfunction. Now, all of this helps us pinpoint whether the SI joint is truly the source of your pain, because once we know that, we can apply the right type of chiropractic adjustment that's both safe and effective for you. Now, let's go over 3 different chiropractic techniques that can help you if you're dealing with SI joint dysfunction. Those are manual adjustments, utilizing the drop table, as well as flexion distraction. The first technique we'll talk about is the manual adjustment for the SI joint. This is a hands-on approach where I use a specific contact, a quick, gentle movement to help free up the joint. In this case, I'm contacting right over the PSIS, which is part of your pelvis and your sacral base. The adjustment itself will be directed from posterior to anterior and slightly inferior, helping that joint move back into its normal motion pattern. For most patients, the adjustment feels like a light, quick pressure, and sometimes you'll hear or feel a small pop. All that is that's just gas being released from the joint, and it's very normal. It's typically not painful, and a lot of people feel immediate sense of relief or improved movement. Now, one adjustment is a great first step, But to really correct SI joint dysfunction, it usually takes a series of adjustments to improve the movement of those segments and the area, along with rehab exercises to strengthen the muscles around the pelvis and low back. The next type of adjustment we're going to go over is the drop table adjustment. This technique utilizes a specific table, a specialized table, that gently drops away whenever I apply pressure, making the adjustment even lighter and more comfortable for the patient. Again, I'm contacting right over that PSIS and sacrum, but instead of using a manual thrust, I'm using body weight and the movement of the table to assist with the adjustment. The direction is the same, encouraging the joint to move back into its proper alignment without that forceful motion. This type of adjustment feels very gentle to the patient. You'll feel the table release under a light pressure. With this adjustment, there's usually no popping sound, and it's very easy on the body, which is why it's a great option for people who are sensitive, older, or in very acute pain. Immediately after, you may notice easier movement and less stiffness. Long term, like manual adjustments, we use drop technique as a part of our structured plan to retrain that SI joint and the surrounding muscles. The third technique we use is called flexion distraction. This is a slower, more controlled method where we use a special table that gently moves your lower spine through flexion or bending and distraction or stretching. Flexion distraction is especially useful when SI joint dysfunction is also affecting the lumbar spine, which it often does, putting pressure on the discs or causing muscle tightness surrounding and above that sacrum. As I apply gentle pressure and the table moves, what we're doing is we're creating a stretching motion that reduces the pressure not just at the SI joint, but along the lower lumbar spine. This is very comfortable. Most people describe it as a slow, soothing stretch without any quick movements or cracking. The goal of flexion distraction is to decompress the joints, improve circulation, and reduce inflammation. Over time, with consistent treatments, patients see better spinal alignment, more flexibility, and less pain overall. If stubborn SI joint pain is controlling how you sit, walk, bend, or even move throughout daily life, you don't have to settle for stretches that barely work or treatments that miss the real issue. With the right evaluation and the right adjustment, whether it's a manual adjustment using the drop table or flexion distraction, you can get real relief safely and quickly. Be sure to look for a well-experienced chiropractor in your area who truly understands SI joint dysfunction and can help you get the relief you've been looking for. If you found value in this video, like and share it so others who might be struggling with the same pain can find it as well. Leave a comment if you've got any questions or just want to share your experience. And lastly, subscribe if you want more real solutions to chronic pain without the guesswork. And for a bonus, if you're wondering how to get relief from SI joint pain when sitting, standing, or sleeping, I invite you to watch the next video here.